Hi, my name is Autumn. I'm going to be your student nurse today. I'm going to provide privacy for my patient and perform hand hygiene upon walking into the room. I'm going to verify with my patient the orders to change out a sterile dressing and just allow them to know what we are going to be doing today. I would ask them if they had any pain or any allergies that need to be known, and I would verify their name and date of birth. Alright, I have all my supplies out in front of me, ready to go for the dressing change. I would provide rationale for the patient as to why we're going to be cleaning their dressing, just so that they know cleaning it out regularly ensures that it's not going to become infected. And then I would tell them that we're going to take off the old dressing and replace it with the new one, and answer any questions that they might have about what we're going to be doing. And I would also get their consent to change out their wound. So my bed is going to be at hip level. I have just performed hand hygiene and I have all my supplies out. I'm going to put on some gloves now. Alright, my gloves are on, I have all my supplies out, and I have a trash can right next to me for any of my supplies. Alright, so now I'm going to expose my patient and the site of where the wound is located. Alright, and I would put an absorbent pad underneath them. I'm going to come in a little closer so that you can see my wound. Alright. Okay. Alright, so I'm going to inspect first my wound. I'm going to assess the color. It is a little red, appears to be a little red still. There is no foul odor coming from it, no discharge appears to be leaking out of the wound. And once I take out my dressing, then we will know how much liquid is on my dressing. Alright, fair amount of liquid is still on the dressing, and I'm going to throw away these supplies. And then I'm going to don clean gloves. Alright. So there is no eschar apparent, there's no black or anything. It looks like it's dying off tissue. With a sterile cotton tipped applicator, you would check for tunneling, and then we are going to measure our wound. So they give us on here, this little guy is already perfect for measuring, and it is right at 10 centimeters, and it is 1 centimeter wide. Alright, so I'm going to write that down so I don't forget. So I would then dispose of that measuring guide in the cotton applicator. And I'm going to don my gloves, start of these ones that I just used, and perform hand hygiene again. And then I'm going to don PPE. Alright, so then I would open the sterile package and prepare all of that, but since it already came this way, I had to open it up already. And I have my gloves on. Alright. Opening the saline solution. My wound kit did not come with a syringe, so I'm just using one that I have at home. Obviously, I wouldn't do that in the real setting. Alright, how much do we need? This isn't even close to how many milliliters it says. But it says 35 milliliters to 60 milliliters. Okay. And we'll take about Alright, so I'm going to begin cleaning, and I have a couple of these pads, these gauze pads. And I would do this, I would continue to put in the saline solution until the liquid flows clear out of the wound. I don't think my piece of bread is going to do that, but we will pretend. I'm going to continue to do this and pat it dry until it's dry. You're not supposed to use the same gauze pad, and then you just gauze it into the biohazard receptacles. All right. I'm then going to cut some of this gauze off and pack the wound. In the video we watched, I believe it showed it being folded up in this manner. Okay, then we're going to use our applicator to get it in there. Our little swab, starting on one end, just gently packing it, not too much pressure into the wound. And then we're going to put this all over top of it. I would then secure that with the tape. I feel like my pad is a little bit too big. So I've secured it with the tape, and then I would use my label, and I would put my initials, the date, and then I would also put what time the dressing change took place. All right. I'm going to remove my gloves and discard them, perform hand hygiene once again. I'm going to ask the patient again if they're in any pain. I would put the side rails up. Then again, perform hand hygiene. Make sure the bed is in the lowest position, locked, and that they have their call light within reach. And I perform hand hygiene after leaving their room again. And then after all that, I would just go back and it says document at my station.